If you're a dog owner, you know that feeling when you find something wrong with your best friend. Your heart just drops. And one of the scariest things to find is this angry, weeping sore that seems to pop up out of nowhere. Okay, let's take a deep breath and dive into this. We're going to figure out exactly what you're dealing with and how to handle it. So you found this spot. It's red, it's wet, it might even smell a little funky, and your dog just will not leave it alone. The big question on your mind is, what in the world is this? Well, you've come to the right place. Today, we're going to break down one of the most common skin problems in dogs, the dreaded hot spot. Okay, take a look at this picture. This is exactly what we're talking about. See how the skin is all raw and inflamed and kind of wet underneath the fur? That is a classic textbook hotspot. If this looks all too familiar, you're going to want to stick around because we're about to explain what causes this and, more importantly, what you can do about it right now. All right, so to solve a problem, you first have to really understand it, right? So let's get into the nitty-gritty of what a hotspot actually is from a medical point of view. So that's the fancy vet speak for it, acute moist dermatitis. Let's break that down. Acute just means it happens fast. Moist dermatitis means exactly what it sounds like, an inflamed, wet skin issue. Sometimes you'll also hear it called pyotraumatic dermatitis, which really just means it's a wound that your dog has inflicted on themselves from all that scratching and licking. Yep, it's a sore they actually create. So how do you know for sure it's a hotspot? Well, here are the dead giveaways. The thing that shocks most owners is the speed. A hotspot can literally go from nothing to a big, painful mess in just a few hours. You'll see that signature wet, red look, and yeah, it might be oozing a bit. And because it's a bacterial infection, they often have a pretty unpleasant smell. Now, this is maybe the most crucial thing to understand. A hotspot isn't something your dog catches. It's the result of a really vicious cycle. It goes like this. Something makes the skin itchy, so the dog licks or scratches it. That irritates the skin, which makes it even itchier, which leads to, you guessed it, more licking and scratching. All that trauma breaks down the skin's surface, letting bacteria move in, and boom, you've got a full-blown hotspot. So what kicks off that initial itch? This list covers the usual suspects. A flea allergy is a huge one. For a sensitive dog, a single flea bite can start a massive reaction. But it could also be anything from allergies to pollen, an ear infection that makes them scratch their neck, or even pain from arthritis that makes them constantly lick at a sore joint. Remember, the hotspot is the symptom. Our job is to play detective and find the trigger. This is a really, really important question because not every round, bald patch on your dog is a hotspot. One of the most common things it gets confused with is ringworm. And you absolutely need to know the difference because the treatments are total opposites. And this chart breaks down the differences perfectly. Just look at the appearance. Hotspots are wet and oozing. Ringworm is typically dry and scaly. Hotspots can seem to explode overnight, while ringworm creeps up more slowly. But here's the most important part. Hotspots are a bacterial infection that needs an antibacterial treatment. Ringworm is a fungal infection that needs an antifungal treatment. If you use the wrong one, it's not going to work, and your dog's just going to stay miserable. Okay, so we've identified the enemy. Now for the part you've been waiting for. What do we do about it? Let's switch gears to the solution and talk about how to get your dog some relief and get that skin healing. Treating a hotspot really boils down to these 4 essential steps. This is your action plan. We've got to expose the area, we've got to clean it, we have to medicate it, and then, and this is critical, we have to stop the dog from making it worse. This first step is completely non-negotiable. Hotspots just love a dark, moist environment. So you have to clip the fur away from the sore and the surrounding area to let the air get in there and help it dry out. And please, please use electric clippers. That skin is super inflamed and sensitive, and it is so easy to accidentally cut your dog with scissors. All right, once that fur is out of the way, it's time for a gentle cleaning. You want to get all that sticky gunk and bacteria off the surface. A mild antiseptic wash, like one with chlorhexidine, is perfect for this. Just be gentle. Dab, don't scrub, because it's really tender. Then, pat it completely dry. Remember, moisture is the enemy here. After it's clean and dry, you'll apply a topical treatment. Now, your vet is the best person to recommend one, but they often have an antibiotic in them to fight the infection, and sometimes a steroid to knock down that inflammation and itching really fast. This is the stuff that really puts out the fire. And that brings us to what might be the single most important step of all. Because all the cleaning and medication in the world won't do a thing if your dog can just go right back to licking and chewing at the area. This is where the famous cone of shame comes in. An Elizabethan collar is your #1 tool for breaking that itch-lick cycle and actually giving the skin a chance to heal. Healing the hot spot you're dealing with right now is great, but the real win is preventing the next one. So let's talk about the long game, how to stop these from coming back, and, just as important, when to know it's time to call in the professionals. This is basically your prevention playbook. And you'll notice all of these things tie directly back to those triggers we talked about. Since fleas are a top cause, you've got to be strict about parasite control. Since moisture is a problem, drying your dog completely after a swim is key. Regular brushing prevents matted fur, which can trap moisture against the skin. It's all about stopping that initial itch before it can ever start. So, how do you know if what you're doing is actually working? Well, this is a pretty typical healing timeline. Within the first 2 days of treatment, that spot should look a lot less angry. It'll start to dry up. Over the next week or so, you should see a nice, healthy scab form. And within a couple of weeks, you should be well on your way to seeing that new hair start to grow back in. This helps you know you're on the right track. Now look, while you can definitely manage a lot of minor hotspots at home if you catch them early, there are absolutely times when you need to stop and just call the vet. Knowing when to make that call is so important for your dog's health. So here are your red flags. If the sore is really big, or it seems to be spreading fast, if your dog seems to be in a lot of pain, or if you've been doing home care for 2 days and it's not looking any better, it's time to call the vet. And, crucially, if hotspots are a recurring problem, you need your vet to help you dig deeper for that underlying cause, to break the cycle for good. And this quote from Cornell's vet school really just says it all. Hotspots do not have to be an inevitable part of life with your dog. Being proactive, paying attention to those triggers, and jumping on a sore the second you see it starting can save both of you a whole lot of misery and money. So the real question is, what's the one thing you can start doing today to prevent the next one?